Hello and welcome. Dr. Mulholland back with you in Niagara Falls, Canada, where we are doing a injectable facial shaping procedure. The 4 key elements. Number 1, injectable RF. Absolutely critical. You must own a Morpheus. Microneedlers don't do it. You can use an Accutite, but you got to be willing to go under the skin with an injectable positive electrode, or both. Once you've injected RF, you've tightened the FSN, you've liquefied the fat, you can stop. That's option number 1. Option number 2, integrate fillers where there's been deflation, modest amounts, toxin where there's depressors, and then the final element of a 4-component non-excisional facelift, injectable suture suspension. Like you've seen maybe 29 other times this year, we've got a young lady with a very unique face who's in her late 60s. She's going to look 55 years old when we're done in what should be a side office 1-hour procedure. I'm going to walk you through all 4 steps. Injectable RF, Accutite, Morpheus, injectable soft tissue volumization through the same port as your Accutite, injectable neuromodulation of depressors that pull the face down so the elevators can elevate, and finally, suture suspension. Okay, let's focus on our young lady here. I'm going to put on my assisted visual device here. These are important. Number 1, so I can see. Number 2, when I put these down and go, oh my God, wow. She's never been looked at as closely as this. And she thinks, wow, Dr. Mulholland knows things no other doctor can see because he's wearing microscopes. Next glove. Okay, so I've got sterile gloves. Now I need a sterile field like I was taking off a basal cell. And so you don't need to go crazy in your side office with a 1/2 or 3/4 sheet. We'll do that now because that's what the pack comes with. You could just square drape this if you wanted to. But, you know, we're in a Marriott. It's not a 4 Seasons, so we'll do a 1/2 sheet. Now, once you've got the 1/2 sheet, that's so maybe your tip of the Accutite doesn't get contaminated. But really, you can just square drape. Before you square drape, you need some sort of sterile prep. We're going to use my favorite, which is just chlorhexidine. I like clear chlorhexidine, not betadine, because it looks clean. If you use pink chlorhexidine, they've got this pink color, and then they read on your post-op instruction sheet, cellulitis. Oh, I think I got cellulitis. It's that you failed to clean off the pink chlorhexidine. Or brown, it looks all poopy. So I like this, chlorhexidine. And then make sure you use a non-water-soluble marker for all your landmarks, because the chlorhexidine will make the water-soluble go away and you lose your landmarks. And so chin up just a bit there, young lady. And so we do a little bit of this. We're going to clean these areas. Don't want to lose our surgical marker, so it lightens a bit but doesn't go away. And we're going to prep the areas where we're going to go under the skin. It's really the ports that need to be clean. Make sure the makeup is removed. We don't want to push particles of makeup with bacteria on it under the skin and lead to inflammatory nodules or cellulitis. For these types of patients in my side office, they come about an hour earlier. They've had their pre-op already. I've discussed with them the risks and benefits at the time of the consult. They're reiterated with Shelby or Sharon and the nurses. They sign their digital consents in the Boomerang EMR at the time of their pre-op. We take great photos, photos worth 1,000 words. And when they come on the day of the procedure, they're ready to do their procedure in the side office. They will take 500 milligrams of Cefazolin, Keflex, 1 hour before. That's it. 500 milligrams of Keflex. If they're pen allergic, 300 of Clinda. I give them Valtrex if we're doing upper lip or perioral management. Everybody, even if they say they've never had a cold sore, 500 of Valtrex. And I don't use narcotics. They can have Toradol. The reason I don't use narcotics is once my mesotherapy lidocaine is in the face, there is 0 pain. There's no pain. So I don't want them nauseated and vomiting and, you know, with a narcotic. Plus, with narcotic abuse nowadays, you never know what the heck's going to happen. So no narcotic.